up everybody? Welcome back to my YouTube channel. I'm super excited because today I'm going to talk about exactly how we insert and remove the Nexplanon, or the implant form of birth control. Now, if you haven't watched my previous video where I talk about all of the details, the benefits, the pros, the cons, the side effects, and all of the deets concerning the Nexplanon, stop watching this video, go watch that one first, and then come back so that you can know how we actually place them. Now for this video, I'm going to be using a prop. This right here is going to simulate the arm, or this portion right here. Now I'm going to take this apart really quickly so I can show you the different layers. So picture this top layer obviously as the skin, this white fuzzy layer as the fat, and then the red layer as the muscle. So let me just adjust this again. And again, remember, this is going to pretend to be our arm. Okay, now that we have a little bit of intro, let's walk by step how we place the Nexplanon and how we remove it. First and foremost, the Nexplanon is placed in the doctor's office. So if you go see your OBGYN, they can place it in the office. So the actual process of inserting a Nexplanon is fairly quick and probably takes 3 to 5 minutes. Now I'm gonna walk you step by step. First, you'll check into your doctor's office just like any other appointment. They'll take your weight, blah, blah, blah. You'll get to your room, and then your doctor will come in to place it. Now it is recommended to place the implant or the Nexplanon in your non-dominant hand. For example, I am right-handed, so I would have it placed in my left arm. That's not a cold and hard fast rule, but it's just a recommendation. So then you're gonna sit on the exam table and you'll lay down and just angle your arm up like this. I always like to tell my patients to feel for that little funny bone in their arm and then just kind of follow a straight line. The Nexplanon or the implant is gonna be around this area. So first up, you're laying down with your arm like this. I will clean off the area, usually with some betadine. That's just to clean off the skin. And next, before we actually place the Nexplanon, we do use numbing medication or a local anesthetic to numb the area. Typically, we use a medication called lidocaine, and this is just injected right underneath the skin. So we identify the area exactly where we want to place the Nexplanon, and we take that needle and inject that lidocaine underneath the skin. Now this sensation, it almost feels like when you go get a shot, it's like a poke and then that little burn as the lidocaine starts to work. Once the lidocaine is placed, and again, we're only using a very minimal amount, so the lidocaine is injected underneath the skin, and then it usually takes about a minute for it to start working. Now, it's still normal to feel pressure and me pushing on your skin, but because that lidocaine is there, you're not gonna feel like that sharp shooting type of pain. Next, I don't actually have the device of a Nexplanon because I can't just take one from work. It obviously is for my patients, but I will insert a picture of the device here. Pretend my finger is that device. We take the device, insert it right underneath the skin, making sure not to hit the muscle, but right underneath the skin along the length of the Nexplanon, so 4 centimeters. We hit the little deploy button and the Nexplanon is deployed, and that's it. Now, this was an old simulation here, but if we lift here, the Nexplanon then is right here, and you can see it. Typically they're white, not green, but this is just demonstrating where the Nexplanon is, and it sits, again, right here. Right in that little fat pocket, not in the muscle. Now on this little thing, I'll be able to show more clearly exactly how we remove them. I know it kind of sucks I didn't have the actual applicator to put the Nexplanon in, but let's now quickly jump into how we remove it. So you're at that 3-year mark and you're ready to have the Nexplanon removed, or maybe you've had it for a year and now you want to have a baby. So you show up to your doctor's office, again, you're in the room and you're laying like this. It's very similar steps that we take to remove the Nexplanon. Again, we clean off the skin, and then we are still going to use that same lidocaine or local anesthesia underneath the skin to remove the Nexplanon. Now you should always be able to feel your Nexplanon, and I can feel it right underneath the model. So when I get my patients, I feel for their Nexplanon, and then when I inject the lidocaine or that numbing medicine, I put it right over the area where the Nexplanon is. So I'd insert and fill that area with lidocaine. Now the removal part can look a little bit more gruesome, I guess, because we do use a scalpel to get out the implant. So again, you have that area numbed. I can feel exactly where the implant is. I take my scalpel, let me feel again, and I will make an incision right underneath wherever I feel that Nexplanon. Let me protect my knife. Again, remember during all of this that your skin is numb. You're not gonna feel that sharp stabbing pain of the knife, but it's normal to feel pressure. Now, a lot of the times, I use this hand to stabilize the backside of the Nexplanon, and then I use this little instrument. We place it right underneath the skin, right until we can feel that Nexplanon, and we remove it. Obviously, this being a model, it makes it pretty straightforward, but everyone's gonna be a little bit different. Sometimes the Nexplanon can become covered in that fat, so it might take a little bit longer for us to get it out. Again, this should never be super painful or uncomfortable. You should just really feel the pressure. So sometimes we may place the instrument in and start kind of trying to feel for exactly where the Nexplanon is. We feel it, lock our instruments, and remove. Well, some fuzzies came out with this one, but don't pay attention to that, it's just the model. Luckily, these little incisions are really small that you don't need a stitch or anything like that. We usually just put a steri strip or a little piece of tape over it and then bandage your arm and you're good to go. Same with the insertion process. There's no need to have a stitch or anything like that. A little piece of steri strip, we bandage your arm and you're good to go. It's really normal that after the insertion or the removal, you may experience some bruising around the arm. You should not feel any pain or discomfort. Besides with the bruising, your arm might be a little bit sore, but if you're having a lot of pain and you don't know what's going on, please reach out to your doctor and let them know. All right, I thought that was a pretty straightforward demonstration of how we do an insertion and removal of the Nexplanon. I think a lot of people, especially when I place them and remove them, they're really, really nervous to have the implant placed, and then once it's done, everyone's reaction is the same. Like, whoa, that was it? That was so quick. And I'm like, yeah. It's pretty straightforward. So if you're considering getting the Nexplanon, I hope you found these videos really helpful, that they kind of put your mind at ease on how truly simple and quick it is to insert and remove the Nexplanon. Have you tried the Nexplanon before? I want to know, leave me your thoughts in the comments down below. And if you're genuinely curious about the IUD, I'm gonna leave the video linked down below on insertion and removal of an IUD. Thank you guys so much for watching this video. I hope you found it useful. I hope you guys have an amazing week. Always remember to be kind and show love to everyone around you. I love you guys. See you in my next video. Bye.